We all know about the UK's mental health crisis. Rising demand, growing waiting lists, NHS services stretched beyond capacity, tragic new mental health statistics. But there's another crisis, one we don't talk about. And it sits inside the very system meant to help. Over the last 5 years, more than £2.7 billion has flowed through the UK's largest mental health charities. After fundraising and retail costs, around £2.13 billion remain to be spent on things that make a difference to everyday people. That's an enormous amount of money. And yet, for too many people, help still isn't there when they need it most. This isn't about blaming individual organisations, many do vital work every day. It's about asking a bigger question. With so much money, knowledge, and goodwill already in the system, why do outcomes keep getting worse? Every year, billions pass through the UK's mental health sector. Most of that money, around 70%, comes from government contracts tied up in rules and conditions. But here's the part that rarely gets mentioned. In just the last 5 years, nearly £1 billion came from donations, legacies, and even charity shops. That's money with far more freedom attached to it. The problem is, instead of being used to create long-term solutions, much of this income gets pulled into plugging gaps or keeping short-term services afloat. It keeps the lights on, but it doesn't transform the system. Now imagine something different. What if the sector agreed that every major charity put aside just 5 or 10% of its unrestricted income into a shared fund? Overnight, you'd have a national infrastructure pot big enough to start building crisis centres, advisory hubs, and specialist units, real places where people can walk through the door and get the help they need. Government contracts could change too. Right now, they're mostly about funding short-term projects like counselling sessions or community programmes. But what if every new contract also had a slice of funding for infrastructure? That could mean a new crisis hub in a town that doesn't have one, or an expansion to an existing hospital wing where beds are desperately short. And donations could be made more tangible. Instead of a vague message like support our work, picture a campaign that tells you your donation will help us open a crisis cafe on your high street, open 7 nights a week. That's the kind of visible, real-world impact people can believe in because they can see it, touch it, and use it. Right now, the mental health sector is full of awareness campaigns, toolkits, apps, and short courses. Most of these focus on the mild to moderate end of the spectrum: stress at work, everyday anxiety, sleep issues. All of that has value, but here's the uncomfortable truth: people with serious conditions like psychosis, eating disorders, or those in acute crisis are often left waiting, sometimes for months or even years. What if we flipped the script? Imagine if part of the sector's resources were ring-fenced specifically for moderate to severe care. That could mean opening specialist units for eating disorders in towns that currently have none, or building dedicated crisis centres where someone experiencing psychosis could walk in and be supported right away instead of being bounced from service to service. Even awareness campaigns could go further. Instead of just telling people to talk about mental health, what if every campaign clearly linked to higher-tier care pathways? For example, a national eating disorder awareness drive that doesn't just raise visibility, but also points people directly to new, properly funded treatment hubs. That way, awareness isn't just talk, it leads to action.